Hello, friends. A very good morning to you from me, Dr. Raman Kapoor. I am a medical acupuncture specialist practicing acupuncture in New Delhi, India for the last over 45 years. Today is a very special day because I am launching a educational channel by the name of Acuknowledge. The basic idea of creating this channel is to be able to share my experiences of 45 years in medical acupuncture practice, wherein I am also presently the head of department of medical acupuncture at a very renowned college hospital in New Delhi by the name of Sir Gangaram Hospital, where I started the department of acupuncture about 28 years ago. So, I would first of all like to tell you that this video will be shared amongst our medical professionals and also amongst the patients or people who would like to have more awareness about acupuncture. But remember, the treatment part, which I will be showing during the video presentation, should only be done by qualified medical practitioners and not by anybody else, because these treatments are to be done at specific acupuncture points, and it is important that anybody who does these treatments should be properly qualified to do so. So today, in my first video, I will be sharing a very interesting therapy which I learned with my wife, Dr. Sunita, almost about 6-7 years ago, and this is known as PNST, or also the name is prickling neurostimulation technique. This technique was developed by a by a Japanese neurosurgeon, Professor Nagata, and both of us specially went to Japan to learn this technique from him. The beautiful part about this technique is that at the points at which PNST is done, the points almost overlap the acupuncture points which we learn when we learned our basic acupuncture. Uh, the principles of this technique is that Professor Nagata uh, studied the dermatome theory. We all know as doctors what are dermatomes. So in all we know there are 30 dermatomes in our body, out of which one of the dermatomes is on the face, and there are 29 more dermatomes which are linked to the different spinal or cervical nerves. So there are the facial dermatome is consisting of the C2 spinal nerve, the facial nerve, and the trigeminal nerve. There are 7 dermatomes which are emanating from the cervical vertebrae. There are 12 dermatomes emanating from the 12 thoracic vertebrae. There are 5 dermatomes from the 5 lumbar vertebrae, and there are 5 more dermatomes from the sacral vertebrae. That in all makes it 30 dermatomes. So the entire concept of PNST is based on prickling along the course of the dermatome. But most importantly, what I am going to share today in the beginning, the first video, is the basic prickling neurostimulation technique, or basic PNST we call it. And this is something which should ideally be done in all patients who are coming to our practice. And why? Because most of the patients who come to us for acupuncture have some amount of stress. So the basic PNST is a treatment which is done to balance the autonomic nervous system. Now we all know very well that the autonomic nervous system consists of 2 parts, the sympathetic nervous system and the parasympathetic nervous system. So the video which I will be showing you now will be demonstrating the points which we are going to use on the scalp area only, and the Jingwell points on the hands, which are used in the basic PNST treatment. Now, we all know this is the model of the scalp. You can see for yourself. Why I especially took this head model was because this will help you identify exactly where am I going to do the prickling. So as I said to you, the prickling is done at the nerve endings from the C2 spinal nerve and on the nerve endings on the face, around the eyes, around the lips and the scalp area, and also the Jingwell points. So I'm just going to show to you how exactly we do it. So if you see the points between the DU23 and the DU16 line, now on this line we will prickle at 6 acupuncture points: 1, 2, 3, 4, 5 and 6. Then along 1.5 chun lateral to this line we will prickle 6 more points: 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. That makes it 18 points in all. Then we will be prickling at the on the line from the apex of the ear. We draw a straight line, and this is along the gallbladder channel. We all know this. So there are 4 points along this: 1, 2, 3, 4. Then we will be doing both the sides. So on this side also I am doing 1, 2, 3, 4. Then I draw a line from the external occipital protuberance to the apex of the ear, and along this line also there are 6 points: 1, 2, 3, 4, 5 and 6. Then another line we draw from the DU16 point to the back of the auricle, and on this line we take again 4 points: 1, 2, 3, 4. We can repeat the same. We will be doing bilateral obviously. So from here to here there are 1, 2, 3, 4, 5 and 6 points, and then from DU16 to the back of the ear 1, 2, 3, 4 points. Once we have done these points, then we come to the points around the eye. So there are 10 points, 5 on each side. We start from the outer border of the eyeball: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then there are 3 points below the eye: 1, 2, 3, 13, 14, 15, 16. Then the last 2 points will be the UB1 points, which makes it 18 points. Then we come to the points around the nose. There are 1, 2, 3, 4, 5, 6, 7 and 8 points. Then around the lips we have points: 1, 2, 3, 4, 5, 6, 7, and then at the angle of the jaw 8, 9, 10 and 11. That's it. That completes the prickling of the face, which is the best treatment, which will immediately, your patient can tell you within a minute or two of finishing this prickling treatment, a feeling of euphoria, a feeling of very, very relaxed feeling. And so many times I have found patients telling me that they have almost gone to sleep, which is the reason is that these points are the main acupuncture points, which are coming from the C2 spinal nerve and branches of the facial nerve and the trigeminal nerve, which we prickled just now. And the basic principle of prickling these points was to balance the autonomic nervous system. The only points left now, which I would be showing you, where we do prickling finally after having done on the scalp, are the 12 Jingwell points, 6 on either hand. You all know that very well by your knowledge of acupuncture. lung 11, Li 1, pericardium 9, triple warmer 1, and H9 and Si 1. And we'll do it on both the hands. So lung 11, Li 1, P9, triple warmer 1, H9 and Si 1. That completes my basic PNST treatment, and I would suggest that this is the probe, the PNST probe, which was developed by Professor Nagata. We imported from Japan. This same probe we are now able to manufacture in India also. Now this is a titanium probe. What we are manufacturing, getting manufactured in India is a stainless steel probe. Both are equally good, and you can utilize any one of them in your practice. So I would strongly advise all my fellow practitioners that they should start using PNST more and more in their practice, and that will bring wonderful results to their patients. I will now conclude the video for today, and next week I'll again be sharing another video with some more interesting facts and some more treatments which I commonly will do with PNST. And thereafter we will also be sharing videos about the clinical acupuncture, different protocols which we follow in our day-to-day clinical practice, which I have obviously learned over the last 45 years of my practice, and I would like to share this knowledge with all of you, so that wherever in the globe you are, you should be able to utilize this knowledge to get very good results for your patients. Thank you.